Hello, everyone. My name is Laura Siepert, and I am your Flex Program Coordinator. I'm here today to explain our brand new work plan template that we have for our new program cycle coming up for fiscal year 24 through fiscal year 28. I do have Megan Lahr from the Flex Monitoring team here as well, along with Kayla from TASC, the Technical Assistance and Services Center. This new work plan template was created in collaboration with all of us. It is very much a labor of love ready for you all. But we want to make sure that you all understand how to use this, because this is really going to shape how FORP gets data from you all in the future, and how you all can collect data for your own state Flex programs. So I will say this took a very long time for us to make sure that we get everything right. We got a lot of input from you all as the Flex coordinators. None of this was done without any of your input. And there's a lot of questions that you all have been asking lately about how do we do things and how can we collect multiple outcomes, and we have an answer for you now. So this work plan template in this Excel spreadsheet, this is not required by any means, but we think this is an easy way to see all of the data that we need from you all. So if you have a different way that you want to format this, you're welcome to do so, but please look at all of this content to make sure that you have this information in there. And I will point you to several resources before we get started in sharing my screen and showing this actual template. The Flex program structure document has been updated, and that has it matches the structure in that document matches the layout of this work plan, and has a very, very, very long list of example outcomes that you all can work to collect. So if you're ever wondering, I want to do this project, but I'm not the financial expert and I don't know how to do that, I don't know what to measure, we've got you covered. It's in that document. The other thing to keep in mind, at the end of the NOFO, there's an appendix that has a glossary of common evaluation terms. This was made by me in an attempt to say, like, this is the language that we at FORP are going to use. It's the language that all of the Flex partners are going to use. So we're all saying the same thing and making sure that everyone understands what we're talking about when we talk about program evaluation. And there's two pieces to this that I really want to highlight that will come into effect later when we talk about this work plan, is the difference between an activity and a project. Now, previously, I will say this, I've used these interchangeably and I didn't really understand the difference between them, but I do now. When we talk about this work plan and the structure of the Flex program now, moving forward, an activity is something that may not have an outcome, right? These are your one-time things that happen where you're not, it might be a meeting, for example, or a webinar series, or my networking meetings of my CFOs, right? That's an activity, but that doesn't necessarily lead to a behavior change. That doesn't necessarily lead to an improvement in something, right? It does lead to an impact, right? You may be able to say that my quarterly networking CFO meeting means that more of my CFOs are now willing to participate in an ACO. That is a really wonderful impact. That is a very big picture pie in the sky thing, but that's not actually going to affect those hospital finances, right? So when we talk about activity, that's what we mean. When I'm talking about a project, we're talking about, the series of activities, the series of inputs that will lead you to an outcome. So my quarterly learning collaborative that meets every couple of months, and everyone is sharing best practices, and then they are going back and implementing those best practices. My revenue cycle management, where someone's coming in and looking at those hospital finances multiple times over the course of a few months and figuring out where we need to make changes, implementing those changes, and then having an outcome with it. So again, all of those definitions are in your NOFO. They are listed on the TASC website, and they are in the structure document now, along with the example outcomes that we can share with you. So with that, I'm going to go ahead and show, I'm going to turn off my camera for recording purposes, and I'm going to share my screen so you all can see what this new work plan looks like. And we'll get moving through this explanation here. So one of the things that you'll notice that's a little bit different, I'll get to that in a second, actually. So one of the things you'll notice right here on the first tab is your instructions. I'm not going to read through all of this on this webinar right now because you all can read this. This would take me a very long time. But Kayla has gone through and made a definition for every single section of the work plan. So go through and read this and make sure that you understand what you're supposed to put in each one of these. And if you have any questions or something's confusing, please let us know. Okay, but here is a very detailed instruction tab for you. So previously, in the last cycle, one thing that you saw was a 5-year tab for all of your work overall, and then a different tab for each program year. one of the things that we noticed was that it was hard, I can say for us as your project officers, to figure out what projects were happening over the course of several years. Was one thing leading to a different outcome after 2 years or maybe after 3 years? It was kind of hard for us to figure that out. So we tried to change that here. And instead of having each year be a different tab, you have each program area now is a different tab. So you can see across the bottom, we have quality improvement, financial and operational improvement, population health, EMS, and CA designation. We did remove innovative model development, and that is because all of those innovative projects can happen in all of these other categories, right? All these other program areas. Most of that work, if you'll say, people were doing a lot of work with rural health clinics, right? There's a lot of quality measures that happen with rural health clinics. You can do that here in quality improvement. Or if you're working on stabilizing their finances or their operations, you can put that in program area too. So by no means should you not try and do those innovative projects anymore. We just want them categorized up here in the other program areas. So you'll notice a little bit of a different structure when we talk about how we've broken down each of these. Instead of having different domains under each program area, we kind of try to make this a little bit more straightforward to say a needs assessment, my education, and my projects, right? What have I learned? Where am I teaching everyone? And what am I doing about that? Okay, so instead of having 8 different domains under quality and 5 different domains under finance, every section is structured this way. Now, the only one that's different, I'll get to this in a second, is quality improvement, where we do have some measure reporting. But to start with, up here at the top, you're going to see your program area 1. We're under quality improvement. Now, one thing we want everyone to think about is this impact goal, right? Your impact is your very, very big picture of what you want to do in quality improvement. So thinking about quality improvement in critical access hospitals, you want to start improving quality of care, right? You can get a little bit more narrow on that if you want to, but think about your big, big picture goal. And then once you have this thought out here under your impact goal, everything below this should feed into that, should accomplish that goal, or at least try to accomplish that goal, right? So your first section here is your needs assessment. You can fill this out however you so choose. If this is going to be a statewide needs assessment for quality improvement, wonderful. If you're going to have 5 hospitals that you want to do a needs assessment for deep down because maybe they're brand new critical access hospitals, or maybe they haven't been participating in MBQuip before, and we need to figure out what their needs are, you can do that as well, right? So you'll explain things here, and we've added this drop-down list for everyone, right? So you can see under this drop-down, we have a quality improvement assessment. So you'll need to choose that. This is going to help us at FORP. You'll see in a little bit how we're going to be able to try to pull some more data out of this, right? This first section over here, column C through E, has not changed. This is the same as it was before. Your expected outputs are what you are expecting to get, right? And your outputs are different than your outcomes. So this would be a case where my quality improvement needs assessment, I'm going to work with 5 hospitals, or I'm going to work with all 20 hospitals that are in my state, right? I am expecting all 20 to participate in this activity, okay? My actual outputs is what you will fill in at the end. Now, this is what actually happened. So if I expected to work with 20 hospitals and I only worked with 15, well, my actual output is 15, right? Your staff responsible is different. This is who's going to do this project. Is it you as the state flex coordinator? Is it your quality contractor? Is it someone else that's outside? Who is going to be responsible for this? And moving over a little bit, I'm going to come back to this engagement impact column. Don't you worry. Over here, when we talk about outcomes from a needs assessment, those are going to be short term, right? My outcomes are that I've identified my needs. Okay. One thing I want to make sure to stress to everyone, when we talk about a needs assessment, if I have discovered that 5 hospitals now have a common need, that is not the same thing as actually changing that and improving something, right? So this is why we talk about a short-term outcome. These are outcomes that can happen more immediately, typically within the first year. If, for example, one of the things that you want to look at is all of those results from the CA quality assessment and inventory that just came out when FMT sends you that data, and you have now discovered you have 10 hospitals that struggle in one thing, or 10 hospitals that share an EMR. If that's part of your needs assessment and you have discovered this, please use that data, put it all in here, use your MVQuip reports, use your Compass data, all of those things. But this is what we mean by a short-term outcome, okay? When we go down to the next section here under education, this is going to be your information sharing, your networking meetings, things like that. So one comment that we had gotten, especially on quality improvement, was, well, if I'm sharing all of the MBQuip reports for every measure, do I have to list that under every single domain? And a lot of it got complicated and it just made the work plans burdensome. So we've all put it here, right? You can just say that you're sharing your MBQuip reports. This is in one section just for your information dissemination. And this is where you can also put my networking meetings. I'm bringing my chief nursing officers together. I'm bringing my quality directors together. And you can choose in here what might be happening. So if you're going to host a networking meeting, for example, and you want to make sure that everybody is coming together on this on CA quality infrastructure, wonderful. You're going to bring them together every quarter. They're going to talk about these things. And you're going to say how many people are expected to be there, or how many hospitals you're expecting to participate, how many did come, who is responsible for this again. And this part is where we can talk a little bit more about an engagement impact. So this is one where we may say, I'm bringing together my quality directors, and my engagement impact is that maybe I had 3 quality directors from hospitals that never participated in MBQuip before. And they came to one of our meetings and now they want to. Now they want to report our quality measures. Now they want to be a part of the Flex program. That's a huge impact. And that absolutely tells a very important story of the Flex program, but that might not be a number, right? That is not the same thing as saying that like 6 of my hospitals improved their HCAP scores. Those are different. But that engagement of bringing people together, trying to make sure that everyone has common goals and shared ground, that's huge. And we want to include that. So please tell us that story here under engagement impact, right? But as I mentioned before, one of the things to keep in mind when we talk about information sharing and networking meetings is that those are not really going to have an outcome so far as a change in a measure, right? I don't expect that just by attending a networking meeting about HCAPs that all of a sudden one hospital is going to have better HCAP scores. What has to happen is that person goes to a networking meeting and then has to go implement something they learned. So those are 2 different things. So you'll see here, I don't expect any outcomes when we talk about this information sharing, right? You sending out as a state Flex coordinator, sending out the MBQuip reports may not necessarily result in a change, but it does have an output that says these people have their data now, right? The difference here under quality improvement versus all of the other program areas that you'll see is this section for reporting support, okay? We know right now we have a lot of new measures that are about to come out with MBQuip 2025. We have to get everybody reporting measures again. And I want to stress, FORP really does want to focus on the actual improvement piece in quality improvement, not just getting people reporting. But now that we have new measures, we do have to include that. We also know there's new critical access hospitals that are coming in, or there may be changes in quality directors. This is where you can talk about your staff turnover, where you as the Flex coordinator has to go in and explain to them what MBQuip is, right? You can do all of that right here. And then you can talk about, I now have more hospitals, my number of hospitals reporting quality measures has improved, right? Anything that talks about an improvement in, an increase in, a reduction in, those things are your outcomes, okay? But I want to stress, it is not an increase in participation that is a long-term outcome, right? The increase in participation is really wonderful, and that falls under your outputs, but your outcome is actually the change in behavior, the change in the measure, something like that. So after we get through all of our education, our reporting support here under quality improvement, we get down into our projects. And if you remember what I said before, the projects are the ones where we have actual defined outcomes that we're looking for. And it may be that the outcomes over the course of 5 years might change. But we want to stress what we at FORP expect. I do not expect you to have an outcome for every single, I don't expect you to have a project for like every single MBQuip measure that's in there, because there's 12. That is a lot. There's so many things in there. What we expect is to have one project with an outcome at a minimum of 1 per program area. And I'll walk through all the other program areas too. But one thing that we really tried to do in the Flex structure document and here was put together a list of all of the very common projects that most people are doing when we talk about Flex funding. Now, I want to stress, you all are already doing these projects. This is nothing different. It's just organized in a different way. So here under quality improvement, you'll see this list. It's a little bit small right here on this Zoom screen, but the list is also in a Flex structure document. We've broken this down to all of the new MBQuip measures, along with the very common other measures that you can still work in, right? There's health equity, your immunization, your antibiotic stewardship, your HCAPs, right? You can see this list goes on. These are all the new MBQuip measures. And then as we get down towards the end, we also have things like ED caps and swing beds and rural health clinics. Those are extra, those are additional, but we know those are very, very common and very important. And so what we want to see is when you talk about your projects, I know probably half of you as flex coordinators are working on swing bed projects. You can choose swing beds right here, and you're going to tell me what your project is. I'm going to have a learning collaborative. I'm going to have a monthly meeting of these hospitals. We're going to work in swing beds and we're going to do these things, right? Well, beyond that, you're going to start telling me what those outcomes are. Over here, we have it written out right now for the next 5 years of the program. I want to stress, this does not mean that I am expecting you to plan out your entire 5 years for every dollar of your flex program right now. We know flex needs flexibility. That is the whole point of the program. We love it. You love it. This is just getting you to think in the long term. So when we're talking about a swing bed project, I have a whole list of outcomes that are in the flex structure document that I'm not going to go into right now. You can look that up yourself, but you can say in here, I want this outcome I expect to happen within the first year. And I know in year 2, after that first thing happens, the second thing is going to happen, right? And between years 2 and 3, we're going to get a different result than we're going to get from years 4 and 5, right? Because some things take longer. For example, if you're talking about swing beds and you're talking about improving revenue, you may not see that result until year 5, right? But we at least want you thinking about those things and then knowing that if you've got a cohort of hospitals that participated in a swing bed project in year 1, you should, by year 3, year 4, year 5, just go back and check on that data, right? And go see what's happened with them and if it actually worked. This is how we at FORP are able to see whether or not our flex funding is actually effective and is actually making a difference, right? So you can tell us what your goal is right here. I am going to reduce readmissions, right? This is a short-term goal for swing beds. I want to reduce readmissions. And then you can say overall, I had 6 hospitals that improved their readmissions rates. Okay. Super easy. Keep it overall. The next piece of this though, and many of you have asked this question, is what happens if I have multiple different hospitals that are participating in a project and they're measuring different outcomes? And that is a very good question. And we have a way around that right now. The example I can give everyone would be something like HCAPs. So you're going to see me change this drop down right here. Let's say you're going to do an HCAPs project. Okay. You're going to explain what it is right here. And you're going to say, I have 5 hospitals. I expect 5 hospitals to participate in an HCAPs project. And then all 5 of them do participate. My overall goal is that they're going to improve in one domain, right? But we know HCAPs has 9 different domains that could be spoken of, right? So this is where we need this information. This is your facility tracking. This is only for hospitals that are participating in your projects and only for the projects. This is not for your activities. I want to stress this again. If you're a state that has 60 critical access hospitals and all of them are participating in a networking meeting, I do not expect you to list all 60 hospitals under this section for this section here for education and meetings, right? This is only for the hospitals that are participating in a narrowed down project. So you can say facility A here, facility 1 is going to be working on quietness at night under HCAPs, right? You can also list here, facility 2 is actually going to work on nurse communication. They're not going to work on quietness at night. They don't need to. And here, this is where it's going to be very simple. Whatever their score was at their baseline, you can put it here. What is their goal? What are they trying to do here? And then what was their result? It does not need to be super lengthy. It can just be a very brief information, but this is how we actually can see if multiple hospitals are participating and measuring different outcomes, what those outcomes are. You can tell us what they are and how they improved. Later on in this webinar, you're going to hear Megan talk a little bit about the data piece of it, but I'm just going to put this there that this is what FORP is hoping to collect so that we can get more information and more data to actually justify when we write reports back to Congress that this is what the Flex program does, right? So you can see this. Here's this section right here, again, only for your projects. And I expect this piece for facility tracking, I do not expect any of this to be listed right away, like in your NCC submission, right? This is why this is your facility tracking for progress reporting only. It's very possible that you may not know in March of the previous year which hospitals will participate in a project the next year. If you have that information, wonderful. If you need to sort it out over the summer, that's okay too. That piece of information comes in at the end of the project year, okay? And we have space here where you can add 2 projects or 3 projects, right? You can add in any of these tabs of the work plan, add a new row. You'll right click and just add a new row if you want to, and add a second thing in here. You can always make this bigger. You can always make it smaller, whatever you need to do. It's very easy. So that covers our quality improvement. For our next section, for finance, you're going to see a very similar structure here, right? Again, as I mentioned, we have our program area 2, finance and operations, your impact goal. What are you trying to achieve? Are you trying to make sure that your hospitals are staying open? Nobody's losing service lines. You're going to move 6 hospitals off your vulnerable hospital list. Whatever those big picture things are, list that there. And everything below it down here should try to meet that goal. Okay. This is the same structure as as quality improvement. You're going to have your needs assessment. Obviously, we need a statewide kind of state of the state, right? When you're talking about your hospital finances. You can choose here either a statewide or an individual, because we know sometimes your individual hospitals might have a different need than what you've discovered at the state level. You are allowed to do both. So in this, what previously kind of happened was a lot of folks were doing a needs assessment at the state level and not then implementing a project afterwards. We want to make sure that you're doing both of those things. So we have your statewide or your individual needs assessment here. I'll repeat this very briefly from the last section. Your expected outputs. If you're doing this with a cohort of hospitals, how many hospitals are you expecting to do this with? How many did do this, right? And who was responsible for it? When we get down here into our information sharing, this is where you're going to be sending your Compass data. You're going to have your CFO networking meetings. What is all of that going to entail, right? And then tell me, what was the engagement impact that you achieved? Are your CFOs now more willing to participate in a value-based care payment plan? Are they going to be participating in an ACO? What does that look like? And then again, we also have our project drop downs here. Are you hosting a specific networking meeting only for, we actually have for workforce, we can do that too, right? We have this section in here. You can choose on this drop down list what is important to you in your projects. When we get to your project, this is again where you're going to be implementing something to have a change in behavior, an increase in, a reduction in, something to that effect. So the example I can fill in for you here, the most common project that all of you work on is revenue cycle management. So you can choose that here in your drop-down list, right? You have your charge master reviews, your revenue cycle management, your billing and coding education, all of those things, right? Under revenue cycle management, we know, and there's a list that is again in the Flex structure document, what our outcomes should be over the course of 5 years, right? So I know that initially I'm going to start seeing a reduction in my claims denials. Okay, that's my goal. My overall result can be that 6 hospitals achieve that. But it's also possible, maybe somebody already did that. Maybe they already have a good claims denial rate and they need to work on something else when it comes to revenue cycle management. You can actually talk about this over here when we have our facility breakdowns. This is the same as we just talked about for that HCAPS project and quality improvement. You're going to list every hospital that's participating. Facility 1, they're aiming to reduce their claims denials. Facility 2 is aiming to improve their days cash on hand or something to that effect, right? We know people have different needs. You are able to put them in a cohort under a shared project and tell us different outcomes. So again, talking about what is their baseline? Where did they start? What is their goal? And what was the result? What did they achieve? And you can say over here in your overall, keep this short and sweet. 6 hospitals improved in or reduced their claims denials rate, right? And if you have any notes you want to add in here and tell us that story, you are more than welcome to do so. We know sometimes there's more of a qualitative aspect to what you are trying to share. You are welcome to fill this in. You don't have to, but you are welcome to do so. And again, this is the same as in quality improvement. We expect a minimum of 1 project per program area with outcomes. However, if you have more than 1, please continue doing them. We want to see more information from you as much as you have. You have space here. You can keep adding more. You can take out some if you need to. We have plenty of space in this, okay? Again, the full list of all the projects and all of the possible outcomes is in the Flex structure document. It will break down everything that is in this drop-down list, okay? And this is where you also have the opportunity, as I mentioned, there are space for RHCs. We don't have really defined outcomes that are coming from the Flex monitoring team on rural health clinics yet, but that does not mean that you can't do that project. That means you can choose what an outcome might be for you and what might work. And you also have the opportunity for other. If there is a project that you want to do that may not be in this list, obviously, please check with your project officer, but we always, under every single section here, we have a section for other, and you can add in something that might be important to you, okay? I will move on now to population health. We have the same setup here, the same structure, right? My needs assessment, my education, and my projects. So I'm going to participate in a needs assessment. It can either be statewide, it can be with individual hospitals. I want to remind everyone and stress here, when I'm talking about a population health needs assessment, that is not the community health needs assessment, the CHNA, that is required by the IRS for all 501c3 hospitals. That is not that. Flex funding cannot pay to complete that CHNA. What flex funding can do is if you at the state need to do a different bit of CHNA, or not CHNA, different bit of population health needs assessment research, you can do that. You can also pay to implement the findings that came from a CHNA, but you cannot complete the CHNA itself, okay? The same here for our education. These are your networking meetings, sharing helpful resources, sharing data, all of those pieces. When we come here to our projects, the thing about population health is that this is very, very broad. There are so many things that you can do in population health. We tried as FORP to narrow this down, and we put it into a few different buckets, as we call them. But even the list of outcomes within those buckets is huge. I may not have gotten all of them in the Flex structure document. I got as many as I could. Those all came from the Flex monitoring team with example outcomes, but that may not be everything. You may have something else that you want to work on, right? But our buckets here for population health are primary care, behavioral health integration, chronic care management, substance use disorder, community engagement, health equity, or other. So really think about whatever you're trying to work on and see if it fits in these buckets before trying to pick other. But think about just how broad chronic care management might be, right? If you have 5 hospitals that are participating in a chronic care management cohort, that's wonderful. You can say that you have 5, you expect 5 of them to participate. All of them did. Maybe facility 1 is working on diabetes management. Maybe facility 2 is working on high blood pressure management, right? There may be multiple different things, but they're all part of chronic care management. So again, this is the flexibility for you to tell your hospitals, you can work on this and collect a different outcome, but we still need all of that data to report back up to FORP. So again, your baseline, your goal, and your result. And over here is where we talk about the big picture and the overall, right? My short term is that maybe I have more hospitals that are engaged in a chronic care management program, right? And then my intermediate is entirely different. My intermediate is going to take it a step further. Who's reducing who's reducing their diabetes rates, their A1C results? Who might be participating more in blood pressure management programs, things like that. So keep this in mind. Again, you can do as many projects as you want. We expect 1, but you have space here to do more than 1 if you would like. EMS is going to look the same, okay? You're going to see a pattern here. Every program area has their impact goal at the top. What are you trying to achieve? And then everything below it, how are those projects, activities, meetings meeting your goal? So under here, we do have, again, statewide or individual needs assessment and action planning. Now, this can be a statewide needs assessment, or you can do this with certain direct EMS agencies, right? We know each one might have different needs, so you are welcome to do all of that. Education is the same. Are you bringing people together for networking meetings? Is this going to be staff education? Is it leadership education? What is the goal of this? Are they now more engaged in participating in Flex projects? Lovely. We want that. We want to hear that story again. And your EMS projects, here is your drop-down list. And again, check the Flex structure document for all of this. Your projects are going to be the things where we're working in actual quality improvement. We're collecting quality data for EMS agencies. Are we trying to stabilize their finances? Are we doing recruitment and retention for their workforce? What kind of collaborative activities are we doing? The collaborative activities might include community paramedicine. Again, check the Flex structure document for all of the examples of things you may be able to do and the outcomes. This is going to look the exact same way. We're going to have different facilities. So your EMS agencies completing projects here, and they have the opportunity to pick different outcomes if they want to. And this is the same setup as the other ones, where this is going to be your big picture over here. My short-term goal overall is this one thing. This was and then here was my big picture result. So keep that in mind when you're looking through this. This is kind of this section over here of years 1 through 5 is your big picture. And this section here is going to be for individual hospital level data, or in this case, EMS agency data. Okay. Our last section is CA designation. This looks a little bit different because there's not really an outcome that can come from a CA designation, right? This is required if a hospital requests it. So this is either doing financial feasibility studies where CAs are considering converting to a CA, or maybe they're going to reopen a closed hospital, or this CA decides that this is not working for them and they need to convert to a different type of facility. This is all required in the Flex program, and you can list here what is happening. And in your dropdown, you're going to choose one of these two things, right? Either a conversion or a transition. And all we would have to say in here, your expected outputs and your actual outputs is that a hospital did convert or did not convert. If your impact is something really cool, like you have a really wonderful story that you want to share, please share that with us. Especially lately, now that we have a change in the definition of primary roads, we know that many states have the opportunity to have new hospitals now. And if you have a story where a hospital gets to reopen because they now meet the mileage to be a critical access hospital, I think that is a really great story. And that tells a wonderful, wonderful thing back to Congress on the importance of this program. So CA designation looks a little bit different in the fact that there are no outcomes, but you do have outputs to require. And I think that is it for my spiel, and Megan can go with the data now. Megan.
Perfect. Laura, would you be able to go back to one of the other tabs to look at the facility level?
Sure. How about finance? Does that work?
Perfect. That's great. So we're really excited about the facility tracking sections that's in this new work plan because it's really important to track the outcomes of the individual facilities at that facility level. So you can look for that improvement in outcomes. And that also, like Laura mentioned, at the federal level, that the federal office and Flex partners can use these data to look across states and combine the data to be able to see how CAs across the country are doing in these different program areas and to really show effectiveness of the program. So on the national level, if we're just provided with state level data, such as an average or another summary about all of your hospitals, how they're doing on outcomes, we're really not able to take that information and aggregate it or add it all up nationally without having that individual hospital information. And so in addition to the outcome data, it's really important too for us to be able to see what activities you're implementing. And so this section does a really good job of putting all that information there, but still allowing you the flexibility to individualize things for each of the facilities that are working in a project. And so all those fields down there in that facility tracking section are super important to fill in. And if you do this, you'll have all that information needed to report by the end of the year as well. And so it's really being able to help yourself out and track it all in one spot because you can refer back to your work plan as you're going through the year. One thing I'd say about being able to fill this in, if you haven't been able to attend the evaluation webinar series, I'd encourage you to go track that down and watch those recordings. Some of that information will help you think through how you look at data you have, how you use that to think through developing a project or creating a theory of change or whatever it may be, but just thinking about how you get to planning a project and deciding, what outcomes you'll want to track across time and kind of just looking at all of those things. And so all that information you'll fill in here with your work plan. Like Laura mentioned, this facility level information will be so helpful, especially in working with cohorts or smaller groups of your hospitals. There is not the expectation that you're going to list all of your facilities here. And so it shouldn't be a really long list. It shouldn't be overly burdensome. It should really be a helpful place. You can, like she said, you can have individual outcomes, different outcomes for their different facilities, acknowledging they all are not going to be working on the same thing, especially within age caps or within swing beds, some of those bigger areas in finance as well. But the goals too, those can be different. And so looking in that section, you can have different outcomes listed in that column C, you can have different goals in that column E, and obviously you'll have different baselines and results. And so really thinking about individualizing this for your hospitals. It's also likely for thinking about your goals that your hospitals are going to be starting at different points. And so even, across outcomes, or if they're even working on the same outcomes, they're going to be starting at different places. And so perhaps it's thinking about a percentage increase or decrease in a measure, or possibly achieving a known benchmark especially for quality or finance and operational outcomes, where there are some benchmarks. Thinking about, how can this facility improve on that outcome, but it's also being realistic. It's not looking for huge jumps over time, but really thinking through what changes can you make? What are your activities going to do? And how might that be shown in the outcomes? And then that notes section over in G in those following columns, there are going to be things that don't fit in any of the other boxes. And it's really important to capture that. And this is, again, it's really a place for you to keep all of your information in one spot, to have this facility level data. There's going to be turnover, there's going to be things that happen, but it's just all in one spot, so you can easily report it at the end of the year, that you have this information as you think about the next year. What might you want to do? And just keeping this at hand as you're filling in your work plan and reporting back. Laura, one thing I'm thinking about before we wrap up is, would you be able to just walk through and mention something we haven't touched on, or which areas of the work plan you would expect to be filled out when the NOFO is submitted versus which are sections to be filled out during the year?
Yes, absolutely. One thing before we go into that, I will say, just because this piece of information, Megan, that you shared with me really helped me to visualize this in my brain. One of the questions that we had been getting recently was, in the case of a finance project, for example, if all of my hospitals are working to achieve the same outcome, but they achieved different things, right? How do I report that back? How do I say that one hospital improved their days cash on hand and went from 2 to 20, whereas one hospital maybe improved their days cash on hand and only went from 5 to 7? And that is why we put this here for that individual hospital data, because there's not really a way in the old work plan to show that. Like, do you average it? Do you not? Do you list out every hospital? So I just wanted to put that out there, that because Megan, that you were the one who explained that to me, that is one reason why we did this.
Yeah, absolutely. It's right. It's not just focusing on did they improve, but really looking at kind of the additional information to show how much are they improving, or really what does that look like over time?
Yeah. So, and Megan brings up a good point of, what do we expect to come for the application versus what comes in at the progress report, right? So what I would expect at the application level, and this may be at the NOFO, or if someone is watching this later when it's time for an NCC progress report, things like that. Those things are, when you're submitting that is your plan for the next year, right? It is not what you've achieved. So right now, what I would expect for the application to come in is what you are planning to do. So what is my activity going to be here under my assessment? What is my activity going to be under my networking meetings? Do I have 3 of them? Are they different topics? Tell me those things, right? And then tell me what kind of a project you are anticipating doing. And then we need to know what you are expecting, right? Oh, that just merged on my cells. Sorry. This column right here, column C. What are you expecting? I need to know, do you expect 7 hospitals to participate, or 10, or all 70 of them, whatever it might be? Anything that says for progress reporting only, this is what you have achieved. So this comes in at the end, right? This would come in when you're talking about your end of year report. This would also be the space during an NCC year where you let us know how things are going so far, right? Anything that comes in for an application as far as your plan, that you don't need to put in anything that's actual, or your results, right? So everything, when we talk about what this engagement impact might be, complete for progress reporting only, that will come later. The thing that I will say, when we get down here to your projects, I do expect to have something as far as your outcome description listed here. What are you anticipating that you're going to measure? If you know that you're going to do a revenue cycle management project, then you should have some kind of an idea that says, I want to improve my days cash, or my claims denials rates in my short term. My intermediate is going to be, outcome 2. That's going to come a little bit later. My long term is going to be my days cash on hand, right? Because all of those are examples that are listed in the Flex structure document. There is a difference. If you, for example, this is going to be a very one-time exception. If you come back and say, I have a whole bunch of brand new hospitals that have never participated in Flex before, and I don't even know what their needs are, right? So I don't quite know what my outcomes will be until I know what their needs are. Well, then that's okay. We can figure that out along the way. But for your hospitals where you've done some of this data and you figured this out, especially these ones that have been participating in a Flex program for 15, 20 years, most of you as Flex coordinators know what a lot of their needs are. You've seen their finance data. You've seen their quality data. You know where their needs are lying and where they're struggling. So we at least want to have an idea over here in your outcome description of what you are trying to measure and what you're trying to improve over the course of 5 years. We don't need this facility tracking information, because this is going to be what actually happened, your results. I can't ask you for that information in your NOFO submission, in your application submission, right? That comes at the end for your progress reports. And I will also say, you can change this. If something happens along the way and you're working in a revenue cycle project, and then all of a sudden there's a big change in the hospital and their finances are different, or something comes up, we can change those outcomes. That is not a problem. There's always flexibility built within the Flex program. But yeah, we want to know what your plan is for the year and what you are trying to measure. Does that make sense?
Yes.
Perfect. And with that, I think we've covered everything. So I'm going to stop sharing my screen and I will turn my camera on briefly one moment to just say thank you so much for watching this whole video. I know it's long. I know it's complicated to listen to someone talk about this. If you have any questions about this work plan, there is another version and an example that is on the task website that is what a completed work plan would look like. It is an example of what you would submit at the progress report stage with all of the hospital information, all of their goals, what their results were. So look for that on the task website. We're going to send all this information out in emails and they'll all be put together. And you can always reach out to any of your project officers, the folks on the task team, the FMT folks are here to look at data. So please don't hesitate to reach out with any questions. And with that, thank you so much.